Good morning, I'm Jessica Lovell. Today, we bring you an encore presentation of one of our very favorite programs. Our team is working hard behind the scenes to bring you more amazing stories when our live programming returns in September. If there is an urgent update from the health system, of course, we will be here to let you know first. Until then, please enjoy this encore presentation and make it a great day.
And I was like, well, how can this get worse? Like, my husband just died and now you're telling me my daughter could get it.
Coming up today, confronting cancer at just 17 years old, the gene mutation that led to a life-changing surgery, removing her stomach. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Isabel Bright takes after her name. She is incredibly smart and very driven, but sadly, she also takes after her father in a way no 17-year-old would expect.
It was unreal, and it still feels unreal because to me, in my mind, I can still just call him.
But 17-year-old Isabel Bright can't just call her dad.
Come here.
Pretty indescribable, because there's some days where I still don't, like there's some days where it still just hits me.
It's been tough on Isabel's mom too. Wayne's cancer came on fast and took him within months.
One day it feels fine, and the next it hits you like a bag of bricks.
What's worse, now her daughter is facing the same fight.
But that's a Kiwi movie.
Isabel was tested for the same genetic mutation that caused the cancer that took the life of her father and grandfather. And she had cancer.
Yeah, it was pretty shocking. I actually sat and I was like, are you sure? Are you sure it's just not like one cell? Can we call it cancer? I was pretty much in denial because I don't look or feel sick.
Isabel was referred to the expert team at the University of Kansas Cancer Center, where doctors recommended she have her stomach removed.
They said that we could just remove the cancer and she would have to have endoscopies every 3 months, and I would rather just have the stomach out and not worry, because it's very aggressive and it spreads very quickly.
Isabel had questions.
My main question is, could I still eat chocolate? Because I love my chocolate. I have a brownie every day.
Mom Emily just wanted her daughter's cancer gone, but left the decision up to her.
She's pretty headstrong, had it in her head that's what she was gonna do, and she didn't question anything. In fact, when I told her she had the gene, I was upset and I was crying.
Yeah.
And she's like, Mom, I figured I had it anyways.
And what would her dad say?
He would be like, this is the cards you've been dealt with, and you just gotta make the best out of it.
And this young lady has a lot to get to.
I either want to be a neuroscientist or an oncologist.
Yeah, she's got plans, she's got goals, she's determined, so it's not going to stop her.
I'm also at peace because I know I won't end up like my father.
And we're glad to have Isabel and her mom Emily joining us here in studio with us this morning, alongside her surgeon, Dr. Mazen Alkaspouls, a surgical oncologist here at the University of Kansas Cancer Center. And also joining us virtually is Dr. A.J. Banzel, the medical director of gastroenterology cancers prevention clinic at the KU Cancer Center. He is an expert on the gene mutation that Isabel has. So we are so glad to have everyone here with us today. Isabel, Emily, good to have you. Dr. Alkaspouls, how good is it to see these ladies here today with us?
Thank you.
Good to see Isabel doing well.
Yeah, in fact, when she walked in, she looked great for someone who had the big surgery she had. So I'm really proud that she's done really well. And
Isabel, just a month out from having the surgery right?
Roughly a month or two, yeah.
So how are you feeling here this morning with us?
I'm feeling pretty good. Like, I'm moving around, I'm going back to school slowly, so.
What were your first symptoms that led to ultimately having your stomach removed?
I don't think I had any symptoms. I was feeling great. I could have gone months or years without knowing. It was no symptoms at all.
Dr. Alkaspouls, what are we to make of that? That's always scary when we say no symptoms, hiding inside us.
Yes, and that's a good point. So most people who have stomach cancer in the United States, they present with advanced disease, you see, but she was undergoing surveillance because she had the genetic mutation that made her susceptible to gastric cancer. And so when they biopsied one of the areas in her stomach, it did show cancer in its very earliest phases. So in other words, she didn't have symptoms. In a lot of ways, I mean, it's obviously no one feels lucky to have this genetic mutation, but it's rare to catch what you have early like that. In other words, in a way where it's cured, so it's fantastic.
So you end up having this big surgery, having your stomach removed. You pushed it back so that you could finish your CNA program, correct?
Yes.
You pushed off school. So where are you with the program right now, I have to ask?
I got my CNA official certificate, so I'm officially CNA, and I just got into Washburn Tech for phlebotomy.
Congratulations.
Thank you.
Very, very good. Emily, you said that you left this decision up to Isabel. She's 17 years old. Why was that so important to hand her the reins and let her make up her mind on this?
Well, she had seen what her dad had gone through, and she's old enough to know like what she wants in her life. So I was hoping she'd made the right decision, which she did. So yeah.
Well, that's hard. I mean, and you watched your husband go through this, and so that had to play a big part in wanting Isabel to be able to make that decision.
Yes.
What was that like for you, watching your husband go through this?
I mean, it's pretty hard watching somebody you love die a little bit more each day. So there's not really much I could say.
And then getting this news that your daughter is going to face this decision as a mother, what was going through your mind?
Well, I guess I was just happy that we found it so early, and knowing that no matter which option she chose, it was still better off than what it could have been had we not even known she had the gene mutation.
Well, yeah, Dr. Alcaz-Pools,
Yes.
I mean, you meet these ladies, they're trying to make this decision. How did you
Yes.
kind of help them walk through that?
Well, in her case, she had been diagnosed with the actual cancer, again, in its earliest phases. But the kind of cancer that people get from this genetic mutation, it's called diffuse type stomach cancer. It's a bad one. I mean, it's the one that progresses really quickly. And more importantly, it's really hard to diagnose, meaning things could look normal when you look at the lining of the stomach, yet there could be an underlying cancer. Again, it's got a certain name, but that's the scary part. Dr. Benzo will, of course, talk to you about surveillance. There are surveillance methods today because we know a lot more about the genetic mutation now. But I think in your case, I think there are a lot of factors, and I actually support your decision because the fact that you actually already had a cancer, to me, there was a very high probability of having other cancers in your stomach when I removed it. I know that didn't show it, but there's a very high probability. In fact, I'd say that most of the patients, when I removed the stomach in a case like yours, by far, I think every other one had more cancer in it, you see. And that's the scary part. Again, Dr. Benzo will discuss surveillance for this because we have come a long way, and he'll talk about that.
And you said that Isabel was your youngest patient to have this type of surgery.
Absolutely, the youngest. I think the other youngest was in their 20s. So yes.
How does this impact someone of this age, going forward?
Yeah, I mean, the great thing about Isabel is that she's young. I can tell you anecdotally, I don't know if anyone's studied this, but young people bounce back a lot better. Now, there are other diseases where you need this big surgery, and they definitely do a lot better than adults. So you'll adapt. The way it's going to change for her is she's going to have to eat smaller meals more frequently every day. Like every 3 to 4 hours, she should be eating something. She can't take in a lot of sugars because she can get a certain symptom called dumping syndrome. It's kind of like a hormonal response to sugars getting inside your small bowel really quickly. Your insulin levels shoot way up. Also, fluid from outside of the small intestine just flies into the bowel, and you get diarrhea and cramping. I don't know if you've experienced that. I don't remember if you have. But you do have to minimize the amount of sugar you take. Maybe she gets away with it. I don't know.
Well, let's
But-
ask her, because we have to ask that important question. Are you able to have that daily brownie?
Not the daily brownie, but I have slowly increased my sugar intake, so I can have 2 little sticks of a Kit Kat bar, or I can have 1 to 2 small bites of a chocolate cake.
Okay.
Excellent.
Is that good for? Is that giving you your
Yes,
chocolate fix?
It's giving me my chocolate.
Okay.
There's also 0 sugar chocolate, so there's 0 sugar chocolate Hershey bars I've been having, or 0 sugar Reese's cups that I've
Good.
also been having.
Dr. Alcas-Pool, she's being a good patient.
Oh, she's phenomenal. Yeah, I mean, I'm telling you, she looks amazing for somebody who'd undergone what she underwent. Usually it takes about a year before the habit kicks in where they're used to having food around all the time. That's the hard part, is you gotta have food around. And at first it's a struggle, but after, I just in my experience, about a year, people just kind of get it, and it just becomes like a habit to have food around. But it is tricky, because if you don't eat the right way, you'll lose a lot of weight. You're already skinny. You began really skinny, and you can imagine losing another 20% of your body weight, right? And so it's really important that you eat the right way. Plus, you won't be tired all the time if you don't eat the right way. So it's a big difference.
And she's a teenager.
And she's a teenager.
Mom, jump in here. What's it like? Just dietary needs at home. Have you seen a bunch of changes, or?
Yes, she has an alarm, and she eats. It seems like she's always eating something. When she started going back to school recently, she has to take a lunch bag full of food, and she has to eat every class period. So yeah.
Making those changes little by little. Let's bring in Dr. A.J. Banzel. Dr. Banzel, Isabel was given the choice to remove her stomach or remove just the cancer and do those follow-ups every 3 months. What are the benefits of removing it entirely now?
Great question. And first of all, before I begin, I am so proud of Isabel, and she's so strong. My daughter just turned 19, and I can imagine how these young people, as a young person, she had to make this big decision. Coming back to the question, so what happens in this syndrome, I completely support the decision made by Isabel and Dr. Alcas-Pools. So, stomach is a large organ, and there are many, many cells in there. And typically in this situation, we see multiple foci of cancer, so which may not be seen during endoscopy. So even though the cancer maybe was found in one location, early cancer, we cannot take a chance with missing out on foci of cancers in other locations. So clearly in this situation, if you found a focus of cancer, the whole idea is to remove the entire stomach, which can completely reduce the risk of getting gastric cancer in the future, or make it 0.
Isabel's dad had what's called signet ring cell carcinoma. How aggressive is that cancer?
Unfortunately, as Dr. Alcas-Pools mentioned earlier, it's very aggressive. A lot of it depends on the stage, but unfortunately, it's difficult to diagnose this form of cancer in early stage with the methods we have. He talked about surveillance, which basically means that we do endoscopy, and there are 2 different protocols we follow. So one is called the Cambridge protocol. We go inside the stomach and take 30 biopsies. And then there's a second protocol from Bethesda called the Bethesda protocol, in which we do 88 biopsies, which is a lot for anybody to handle. I mean, patients do fine, but it's a lot of biopsies. Still, we miss cancer. So it's a difficult situation, although our tools are getting better.
So does that mean, so if her father and her grandfather had the same mutation, does that mean that's the same cancer?
Yeah, so it's probably the same histology of cancer. So in this particular syndrome, there are 2 different genes which can be involved, CDH1 and CTNNA1, and the histology of cancer depends on the gene which was lost. So most likely, yes. Without looking at their histology, we can't be absolutely sure, but most likely it's the same type of cancer in terms of histology and behavior.
Dr. Alcas-Pools, how is this going to change her day-to-day life, Isabel's day-to-day life? What can she expect, in these teen years, into her young 20s, but moving on as we get older?
Yes, and I'm glad you asked that. I've been here long enough where I've operated on young people and followed them a decade plus. And like I said, I think younger people do a lot better. I just think the way it's going to affect her mainly is just remembering to eat the right way every day, you know, and but otherwise she'll have a normal life. You know, now Dr. Banzel may talk about this too, but we have to remember that having these mutations make you susceptible to other cancers, and that's critical because breast cancer is not that uncommon. You know, even uterine and ovarian, but breasts especially, you know, a good percentage of women with CDH1 get, I mean, I think it's like 40% can get breast cancer in their lifetime, and that's a big number. So that's something you have to be aware of. The colon, same thing. The colon is susceptible, so you have to get your colonoscopies when it's time. But all these things are critical. So your mind, you have to be very mindful for the rest of your life, basically, because you're not completely out of the woods, you know. So
making sure you're getting your screenings, which is something we talk about. Well, let's bring in Dr. Banzel to talk about these mutations, these gene mutations, because he's really considered an expert on it, and he's giving us our science lesson. He's promised to talk to us in a level that we can all understand. So, really, Isabel tested positive for the same gene mutation as her father did, and had that genetic test taken. Tell us about what that test is looking for. What does it tell us? And then just really kind of break down exactly what these genetic mutations are. What do we need to know about them, and what are we learning about them?
Yeah, let's talk a little bit about history. So Jessica, great question. So the way we learned about this mutation is through Maori families in New Zealand. So there were 3 Maori families where multi-generational deaths happened because of gastric cancer as young as 17, 18, 21. And scientists extracted DNA from their blood and ran it through a sequencer, which gave us a sense of how their CDH1 gene looked from the rest of the general population, and found out there was a mutation. So that's how these genes are discovered. And it's almost like predicting the future, because if Isabel had not done the testing, we would not have known about the gene, and we would not know how to prepare for her future. So that's where genetic testing, which is becoming more and more common, cheaper, can really help us risk stratify individuals about their future cancer risks, so we can be proactive, not just reactive.
Dr. Banzel, so it wouldn't surprise you to learn that Isabel's father's from New Zealand?
Wow.
Yeah.
I didn't know either.
Yeah, he is.
Yes. Wow. Yeah, because
Yes.
one of the first publications of this mutation was of Maori families from New Zealand. What was his ancestry? Or, I mean, he was in New Zealand, but his ancestry?
Yeah, Emily, please share.
He's of European descent, but yeah, we knew about the history of the genetic mutation being pretty well researched in New Zealand, and he was actually it was in New Zealand where they found that he had the gene mutation.
So he was in New Zealand, but doesn't he have family didn't you say he had family?
Yeah.
His family
all
was
of his family still
Yeah,
there.
okay. So there was some sort of links back into New Zealand somehow?
Yeah.
Okay, interesting. Very interesting. Okay. So again, let's talk a little bit more about this, the risk of breast cancer as she moves forward. Dr. Alkas-Pouls mentioned that, Dr. Banzel, but can you just touch a little bit more on those risks?
Absolutely. So the type of breast cancer we get in this situation is called lobular breast cancer. So in this particular syndrome, which is a syndrome of cancers of a type called diffuse gastric cancer, there are 2 main mutations, CDH1 and CTNNA1, and depending on which type you have, the risk of breast cancer can vary, but as Dr. Alkas-Pouls mentioned, it can be as high as 40 to 50%. So at KU, we have a comprehensive program where Dr. Alkas-Pouls, me, breast cancer prevention docs, all of work together. So definitely Isabel should also see doctors in the breast cancer prevention clinic so we can be proactive.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. So we've been talking about food and some of those changes that Isabel's going to need to make to her diet, and she's already showing that she's doing that. How does Isabel digest food without a stomach?
Yes, that's a great question. So the GI tract is reconstructed in a way where, although she has no stomach, the pancreatic enzymes and the bile from the liver still meet the food at some point when she eats, and it's those types of fluids that actually digest your food. Obviously, with the stomach, the difference is, with the stomach you have this big reservoir, right? And things churn, whereas in the small bowel you don't, and that's why you have to eat small meals. But eventually, once digestion occurs, the vast majority of nutrients that for a human being are actually absorbed from the small intestine. So the small intestine is vital. Your colon can be totally gone and you can still get your nutrients, but that's not the case with the small intestine. And you have essentially all of your small intestine. And so that is a good point that you made.
Dr. Banzel, how important is it to know your family history? When we're talking about not presenting symptoms, how important is that, especially when we're talking about the risk of other cancers down the road?
And that's a $1 million question. So that's why in these situations, we really have to know our family history and genetics and risk factors for individual cancers, because many of these early cancers are completely asymptomatic. And that's something which might change in the future with multi-cancer detection tests, which are blood-based biomarkers for cancer detection, which can look at 50 different cancers in the human body. But that research is ongoing, so we'll hopefully have more non-invasive ways of figuring out who might be at higher risk of cancer versus not.
Isabel, your uncle also tested positive, is that what I understand, of the same mutation, had his stomach removed as well?
Yes.
Have you?
Yes, roughly a year ago, yes.
About a year ago. Have you had a chance to speak with him and see how he's doing?
Yes. So I spoke with him roughly 3 weeks ago, and he's doing great. He can go on walks now. He actually, for Christmas, he had ham and a salad and some alcohol. But no, he's doing great. He's eating, and he told me that it'll take some time, but because I'm younger, after 6 months, I'll be farther ahead than he is, because he's 61, but he's doing great.
Well, we talk about having a support system, but to have kind of a built-in support system of family members that have gone ahead of you, it's pretty unusual. How helpful has that been for you to be able to talk to family members that have also gone through it?
He's been very helpful. If I ever have questions where I'm like, did this food ever affect you this way? He always like, oh yeah, that food affected me that way, or no, I've had these issues with these foods. And it's very interesting to see how, even though we don't have a stomach, how some of us, like he gets affected by bread and I don't. It's very interesting.
Interesting, some differences like that.
Yeah, one of the things I thought of on the way here, we keep talking about having a support group because we do so many of these operations at KU. And, I brainstormed, and I haven't come up with a total plan yet, but I think that would be nice to have in the Kansas City area, just because we do so much of it. And people do struggle, especially if they're older, so to me, it's like group therapy, I think it's great. One thing I want to say, Doctor, we're so lucky to have someone like Dr. Banzel here. To give you an example, 10 years ago, we didn't know a whole lot about this genetic form of cancer. You'd think that we've known about it forever, but it is a very new syndrome that we've really discovered and are just beginning to characterize. And luckily, we have someone like Dr. Banzel. Most places don't have someone like Dr. Banzel, where he's shown an expertise in this area. Mm-hmm. His department, supported him. And I don't think, we realize how lucky, for me to even practice at KU, to have that there. It's a very big team effort.
Totally begged him to come on the show this morning.
Yeah, I'm glad he did.
He's very, very busy. So we thank him for working here and being on our program this morning. Emily, how proud do you think Dad is of Isabel?
He was proud. He's proud of her with everything she does. But I know in his last few months, well, speaking of, this is relatively new. When he was diagnosed with cancer in June of 2022, they did a genetic test and it was inconclusive. And then when they redid it in April of 2023, that's like by that time they had found that it was in fact the gene mutation. And so he was hopeful that even though the cancer was going to take him, that it would help Isabel and it would help the rest of his family, prevent anybody else from going through it. So he would be proud that she decided to have her stomach removed, and yeah.
But how are you handling the loss of your father and just moving forward, living your best life?
I think I have good days and bad days, but I definitely have to give my dad the complete credit. He really did save my life. Like I said, I had no symptoms, so I would just keep going on my life until it's stage 4 and there was nothing to do. So even though I lost my dad, and it's hard on some days, I'm very thankful.
Yeah, you know, obviously, you know, I can't tell a whole lot about a patient that I recently treated, but I can tell you this patient that I treated recently didn't even have a cancer diagnosis. They had CDH1, and I removed their cancer prophylactically, okay? That patient had very advanced stage 4 stomach cancer, not only early, but stage 4. So I'm sure that's very similar to what happened with your husband, you know, and that's more common, is when you have this type of cancer, it's usually found in its most, stage 4. I'd say at least half the time it's stage 4 when you diagnose it. Yeah, not necessarily the CDH1, but the type of gastric cancer, like how it looks under a microscope, the diffuse type. That's how bad that cancer is. It progresses very quickly. Yeah.
Let's get to some questions from our viewers this morning. Dr. Bansal, Stu has a question. He says, so there is the CDH1 mutation, the CTNNA1 mutation that Isabel lives with. Are there other hereditary gene mutations that lead to an increased risk of gastric cancer?
Yes, so these are the primary ones, but the risk of gastric cancer can also increase in a syndrome called Lynch syndrome, which is one of the main things I do. And in that syndrome, the risk of gastric cancer is much lower than this particular syndrome, which Isabel has. So there we do a close surveillance. And also, it's amazing that the type of gene determines the type of lesions you can see in the stomach. So in Lynch syndrome, we are able to see the polyp and the cancer with our when we do endoscopy. Unfortunately, in this diffuse gastric cancer syndrome, the cells can spread throughout the stomach without us finding it. So that makes a difference on how I do my endoscopies in patients with Lynch versus this syndrome.
Andy wants to know if Isabel is working with a nutritionist.
Yes, I am. Very closely.
Really? Okay.
Yes.
It just any tidbits that you've learned?
Just take it slow and just really take it slow, bit by bit. And if it doesn't go well the first time, maybe try again in a week or 2.
And also, technically, they go by dietitian.
Yeah, that was another thing I learned.
There is a difference. There's a difference between the two, right?
That's a big deal. You got to say dietitian, yeah.
They both exist, but there is a difference.
Agreed.
Yes, okay.
He's felt the wrath, too.
He's felt the wrath. Okay. Thank you for clarifying. Becca wants to know, since this is genetic, has Isabel thought about the potential of her children having it? If so, when should children get genetically tested? How soon?
So I can answer that.
Yeah.
Okay.
Go ahead. Oh.
Yeah, Dr.
Yeah,
Benson.
so that's
Dr.
obviously, that's a great question. So obviously Isabel herself is so young, 17. So a lot of this depends on the youngest age of onset of cancer in the family. So that's how we decide. But most often between the ages of 18 and 25, earlier if there's a young onset cancer in the family.
I want to get our takeaways today. Dr. Bansal, I'm going to start with you. What do you want folks who are listening and watching to really take away from this conversation?
Talk to your families. Don't be shy about talking about family history of cancer. That can really help you understand your own risk, especially when you go to your primary care. Go armed with that information so the primary care can guide you how to use your family history of cancer to prepare yourself for your own risk and reduce it. Be proactive like Isabel, so you can take care of your health.
Dr. Banzel, thank you for joining us this morning with your expertise. Always great to see you. Emily, what is the
Thank you
big
so much.
takeaway?
The same, that you really need to know your family history, but also you don't just accept people saying you're fine, just wait, because that's what they told us to do. They said we don't have to have her tested till she was older, but I just kept pushing, and so I'm glad I did. So if you feel like something needs to be done, you should keep going.
Yep, good mama bear advice.
Yeah.
I like it. Before I get your takeaway, I'm going to just share a comment from Jeremy. He says, I just wanted to tell Isabel how amazing she is. I think when we face tough trials, it can really reveal where we're at or how we're doing with what Isabel has gone through and how she has handled it. I think she's going to do incredible and do anything that she puts her mind to. So with that, what's the big takeaway from your story? What do you want people to know?
I want people to know what everyone here is saying. Like, you definitely have to know your family history and get tested early on. Like, no matter if you feel or look fine, you never know what there could be. It's always better to be safe than sorry.
Thank you for sharing your story with us, and be well.
you.
Dr. Alcaz-Pools, I'll let you have the final word. What's the big takeaway?
Yeah, I mean, I hate sounding like a broken record, but this is very, I've said this many times before, you know, hereditary gastric cancer can occur at an early age, and I always say that young people can get cancer. That's very important. You know, you got to be really in tune with your body. And, you know, I know you didn't have symptoms, but I think most young people just feel like there's no chance they can get cancer. And I think that sort of mindset could hurt someone, you know, and I think we all need to be aware that it still can happen in young people. Yeah.
Thank you. Thank you all for being here with us today.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.